sorry. Hi, my name is Sophia Freitag, and today I'm going to be completing my wound care competency. To start, I'm going to have you scan the room to make sure there are no other distractions and that the room is safe to complete in. I'm going to start by knocking on the patient's door and applying hand hygiene. Hi, my name is Sophia, and I will be your student nurse today. Can I please have you say your name and date of birth?
Carol Slopes, 11/15/33.
Perfect. So it looks like we're here to perform a sterile dressing change to the sacral wound. Does that sound about right?
Yep, that sounds about right.
Okay. Can I please have you rate your pain 1 out of 10?
An 8 out of 10.
Okay. So your provider does have 5 milligrams of hydrocodone if you would like that before we start a procedure. Would you like that?
Yes, please.
Okay. I'm going to give you your medicine. And I'll be back in 30 minutes with all of our sterile wound care kit, and I will come and check on you. I'm gonna leave the room, perform hand hygiene. It's been 30 minutes. I'm gonna knock on the door, put on more hand hygiene, and grab all of our sterile supplies. I'm gonna walk in the room and set them down. Hi Carol, how are you feeling?
I'm feeling better.
Can I have you rate your pain 1 out of 10?
A 4 out of 10.
Okay, sounds like a lot better. So I'm gonna start by putting up your bed rail if that is okay.
Yep.
And then raising the bed to a working height. Okay, perfect. And then I'm going to grab the garbage and put it at the base of the bed. Then I'm gonna put on hand hygiene once again. And then, Carol, would it be okay if I put your covers back a little bit?
Yeah, that's okay.
I'm gonna put them down, or put them back a little bit just to provide her some more dignity. I'm gonna put the bed rail down and perform hand hygiene once again. And then I'm going to take our bed protector. Carol, is it okay if I lift up your side to put this under?
Yep, that's okay.
Tell me if there's any pain. Putting it under her hip. Perfect. And then I'm gonna grab this basin and put it right under the wound to allow it to drain naturally. And then I'm gonna perform hand hygiene once again. And then put on non-sterile gloves. Okay. Are you feeling okay, Carol?
Yeah, I'm feeling okay.
Okay. Okay, to start, I'm going to take off the ABD pad and look for any excess drainage, and there is not. That's good. Then I'm going to take the sterile pad with no drainage, and I'm not smelling any odor out of the blue, so that is great. And I'm going to take out the one pad and look for any drainage, which I do not see, so that's great. Now I'm going to grab my measuring tape and a non-sterile cotton swab. To start, I see some slough, which is this yellow part right here. And then I see some granulation right here, which is the red. I am noticing that there is a bony prominence. So to start, I am gonna go around the wound to see if I see any tunnels, which I do sense one here at around 2 o'clock. And I'm going to measure it, which is about 2.5 centimeters deep, and then kind of work my way around the wound to see if I find another tunnel, which I did at around 9 o'clock, I'd say. And I have another 2.5 centimeters. So I'm going to measure under the superior part of the lip of the wound, which I have around 1.5 centimeters. And then I'm gonna go in the inferior part of the lip of the wound, which I have only 0.5 centimeter. So now I can discard of the cotton swab because I'm done using it. I'm gonna measure the width of the wound, which is about 5.5 centimeters, and then the length, which is around 5.5 as well. So I can now discard of this. I'm also gonna discard of my gloves. I'm going to perform hand hygiene. And then I'm going to document that there was no odor and no drainage. However, there was some slough and a bony prominence and some granulation. And then I'll note that what I wrote down of the tunnels and the width and length. And that her pain level after the medication was reduced down to a 4. Okay, now I'm gonna perform hand hygiene again and start with my sterile field. So I'm gonna move the gloves to a different area. And I'm gonna be very careful opening up my wound care tray as I don't want to contaminate it. And then grabbing my sterile field, I'm going to grab it within the 1 centimeter border. And then opening it away, or laying it down away from my body and putting it down. And then there's 2 things that I open up before putting on my sterile gloves. First being the syringe, putting it down away from my body, and then discarding of that. And then the Q-tips, or cotton swabs, and opening it away from my body, and then discarding that as well. Then I'm going to move over to my gloves, and I'm gonna be very careful opening it up. Being careful just to keep my hands within the border. Then using my left hand, I'm going to grab on the inside part of the glove, making sure to not contaminate the sterile side, and then put my hand in. Again, only using the outside. Now using this hand, I'm going to use my 4 fingers and stick it under the lip of the glove, leaving my thumb out, and then sneaking my hand in as well. And it's okay if I don't get on perfectly because this is sterile, so I can use it to help myself adjust. Making sure just to keep it sterile. I'm also keeping my body towards the sterile field and making sure I don't touch my hair and keep my hands above waist level. Now I'm gonna head over to my sterile field and I'm going to grab my saline solution and pour it into this. And then I'm going to grab this and put it on to the syringe. Perfect. And then I'm going to head over to Miss Carol, going about 1 inch above the wound, going back and forth in a motion, going from superior to inferior, and then doing it until the solution runs clear. Once I'm done with that, I am going to discard of it, and I'm going to grab a clean gauze, and I'm going to make a little poof out of it. And then I'm going to go over to Miss Carol again and just lightly pat from the clean part of the wound down to the contaminated part. And then I'm going to throw away that gauze as well. Next, I'm going to grab a gauze and I'm going to put it into our solution, but I'm going to stretch it out like this and then lightly wet it just to make sure it's moist. Then I'm going to grab one of my sterile cotton swabs and move over to the wound. I'm going to start by making sure that I don't touch the outside of the wound. I'm going to start by packing it into any tunnels and any crevices of the wound, making sure that it is all kept with moist. And doing my best. And to only use 1 finger. Okay, now that that is done, I'm going to discard of this. And I'm going to grab a sterile pad. I'm going to lay that on top of the wound. And then grab an ABD pad, blue side up. Put it onto the wound. grabbing some tape, which I probably should have. Get this on that for me. I can get it started. Sorry, intermission. I grabbed a new thing of tape. Thank you. Okay. And then taping each side down. Perfect. Just like that. And then I'm going to throw away anything I've used that is contaminated. So I'm going to throw these away. And I'm going to remove my gloves, making sure to not let the outside touch my hand. Throw it away. I'm going to perform hand hygiene, and then I'm going to put the label on this using the date and the time, and then I'm going to put my initials using ink, not a marker. Okay, Miss Carol, how are you feeling?
I'm feeling better.
Okay, perfect. So I'm going to put her covers back on. I'm going to hand you your call light, okay? And I'm going to put the side rail up. I'm going to lower you to the lowest portion of the bed. Okay. Putting this back down. Carol, could I get your pain level 1 out of 10?
It's a 2 out of 10.
Perfect. So I'm going to chart that the irrigation went well and that it is packed completely using 1 gauze and that it has a sterile cover and an ABD pad. And then I'm going to note that her pain tolerance was tolerated well and that it actually went down. And so then I'm going to exit the room, put on hand hygiene. Can I get you anything, Carol, before I leave?
I'm okay. Thank you.